In this video, I'm going to show you how Primary Care Online can help your patients and staff with care navigation through your practice. This is based through a website platform and also integrates with other services as well, such as Engage Consult, and it can potentially help your patients navigate through the practice so much easier. Let's take a look, shall we?
I know that you've also got other features as well, in particular your Care Navigator Assistant. So shall we have a look at that as well? That seems quite interesting to me at the very least. So yeah, should we take a look at that?
Yeah. So so the Care Navigator, so we built a care navigation tool really to try and tell patients that, look, there's a lot of information. The surgery centers so much information, which is really valuable, but it's really difficult sometimes to get that information across to patients. So we've built a care navigation tool into each website. Again, we fully build this, and it's linked to AI. So we linked to ChatGPT 4, not 3, because 3 is a bit slow and it doesn't work really well. So we built this over the last 6 months. And the bot will sit at the bottom of your website. Again, this video here will tell patients about it, but it can appear in any format really. You can have your own branding on here, your own colouring. If you want, you can start with some starter questions, such as request an urgent appointment, and when the patient clicks on that, it'll provide a link to the patient about how they can go about requesting an urgent appointment. And you can have as many starter questions as you wanted to. We've got analytics built into this, so it'll tell practices what patients are clicking on the most. So, for example, request a non-urgent, or I need a medication request, or an admin query, or how to register. But again, we build this on the data that's provided, so we can our AI tool. Again, fully built by us. There's no onus on the practice to do this. We'll have a video meeting with practice here, so we can build. So the patient types in, for example, physiotherapy. If I've spelled that wrongly, no. They can type in physiotherapy, and it'll tell the patient, okay, you can self-refer to a service. And again, it'll give the source on that, and patient can click on a link so that they can self-refer. Again, we can type in sore throat. We recommend that you access in Wales is the Common Ailment Service or Pharmacy First, and they can click on the link to self-refer to Pharmacy First. Again, we can type in mental health, and it'll as long as the data is there, and when we build this, again, it'll say, okay, here's the A to Z of mental health. Or you can self-refer to Mind, and when they click on the link, it'll take the patient to Mind, and they can access the service there. So when we do build this, we put an entire site map, so it maps the entire website, and if it finds the keyword, then it'll answer the question to the patient. And again, we've got full analytics built into this. This practice can find how many times the patient is accessing this, what types of questions they're putting in. So it'll build a picture, so you start to get big data then around what patients are actually inquiring about. So as long as if the source isn't there, it'll just say, sorry, I'm not able to answer your question, and it'll ask the patient to contact the practice. We do have a separate system where we've got live chat. So the live chat is available, but a lot of practices don't have the facility to have a receptionist on the system just checking with live chat, but we do have the facility available as a separate item. But this is working really well because it just sits on the practice website. It'll answer questions for the patient, and it can't go rogue. It can only answer a question if the data is there. If it's not there, it then asks the patient to contact the surgery. But it's a really good way of informing patients, look, if you have a sore throat, you don't have to find a GP for this. You can access the pharmacy and get free medication with a consultation in your local pharmacy, the Pharmacies First or Common Ailment Service, as it is in Wales. Again, it helps the patient to navigate around the services available to them in the locality. We've also built so that's worked really well as a patient-facing care navigation tool. We were also asked to extend this by our colleagues in primary care and build an internal system for practices. So practices, particularly when I was in practice, we used to have a list or an Excel spreadsheet we used to give our receptionists to care navigate. Very difficult for a receptionist or administrator to find to retain that information, to sort of, for us as managers, to inform the staff and keep them updated. So again, we can have an internal navigator for staff, which can sit internally on your Microsoft Teams or your intranet if you have it, or just a web link, and we can train it to say, okay, well, what is the process for sore throat? And it'll tell the receptionist, okay, for sore throat, refer the patient to the common ailment service for sore throat. So, if you get medication alerts coming through, we can train the AI to recognize that medication alert, and you can type in a keyword, and it'll bring that alert up for the staff internally. So it really helps that to communicate new services to staff, make sure they're up to date, not having to go into Excel spreadsheets and scroll down. Really fast way of staff to find a process internally to the practice, again, which is working really well.
And I guess with that staff chatbot based version, so I'm assuming that's trained based off the resources the practice has access to. So would it allow you to say, for example, where do I refer a patient for pediatric dietitian services, which is often a question I have to ask my own typist numerous times because I forget every time I have to do one.
Yeah, so it's based on so the AI is based on the data you give us. So that we've got an FAQ section of the AI, so you can put a question up. So the question we would put up as the FAQ would be the question you just asked, and then the answer would be the resource that the receptionist or the staff member uses to answer that question. So it's built on it's built and works on the data you give. So if you've got a new question, you just send us that question and the answer. We'll build that as an FAQ, send it to ChatGPT securely for it to be trained on that data, and then when the receptionist does ask that question, it'll bring the answer up that you've asked it to respond with. Okay.
So great potential onboarding tool for staff as well, particularly for newer staff to learn the processes within practices and the workflows that you have. Cool.
Yeah, and it's really a fast way of disseminating information.
Absolutely. One of the things, again, that obviously from our point of view, NHS England very keen and CQC very keen for practices to know how to support their staff to be onboarded effectively and quickly, because let's be honest, general practice changes every day in terms of what we have to do. So being able to navigate that would be really nice and easier. And it sounds like that can definitely help with those aspects.
That is how Primary Care Online can help you with care navigation for your patients through your practice website with some really cool tools. If you want to see specifically how it can help with your website, then definitely check out this video right here. Alternatively, if you want to see how it integrates with Engage Consult, a digital first platform, check out this video right here.